Hi, this is Eitan Shalom at the Body Mind Wellness Center, and I am with my patient. Can I use your name?
Yeah.
Do you care?
No.
Okay, I'm with my patient Harlan, and Harlan he's a young man who's very strong, does a lot of vigorous activity, and this is the second time he's tweaked his back with symptoms that resemble possible mild bulging disc. And I say mild because it's already a lot better after 2 days and he hasn't even seen me yet. But he had sudden sharp back pain with heavy lifting and then pain down his left leg. So I'm going to start by doing a couple of points. Harlan, do you mind putting your hand up on the table there? Yeah, that's good. Couple of points to start with. I'm combining acupuncture with dry needling, although even the acupuncture points that I'm going to do them in a dry needling style. First, I'm going to release this point here, which happens to be the motor point of the upper trapezius, but I'm doing it because of its value in acupuncture theory. This is a point that is very relaxing to all of the muscles and tendons of the whole body, and particularly to the pelvis, which is where he has the problem. So much so that this point is forbidden in pregnancy. So the needle's in, and now I'm going to, there we go. You feel that moving? So I'm just going to do a little bit of this lifting and thrusting. Okay, that needle's in. I'm going to now do the same thing on the quadratus lumborum. And again, his pain's on the left, so I'm going to be getting to the left side. But in preparation, I do something on the opposite side, because especially when we're talking about the spine here, his nerve referral pattern is indicative of L4-5 or L5-S1. And so if there's a bulging disc, you want to relax the muscles on both sides, the erector spinae, the paraspinalis muscles. You want to relax them on both sides of the spine. That you're going to have the maximum effect that way, because what we're doing here is dry needling to release the muscles so that it opens up the vertebral space. This is a very effective treatment for bulging discs. Okay, take a breath and exhale. So I can feel his muscle moving as soon as I get it in. I'm not wearing gloves because I just washed my hands, and I'm going to wash my hands when I'm done. This kind of needling, I really need to be able to feel what I'm doing. You okay? Okay, so good, excellent. So he's experienced with acupuncture, so I can needle him. Take a breath now and exhale. So I'm about 1.5 inches lateral to the spine. You're right there? Excellent. And now I'm going to do, so there's this fascia that runs along the lower part here that I'm going to get some anti-inflammatory needles in. There we go. Feel that release?
Oh, yeah.
Excellent. So we're at L5-S1 there.
Oh.
Excellent. You okay?
Yeah.
Keep breathing.
That was a ticklish.
Good. Let me just make sure that the camera is actually running, because yes, we're at 5 minutes and 30 seconds. All right, great. So this will be part 1. Okay, so I've done those. I'm going to now check the motor point of the quadratus lumborum, because the quadratus lumborum muscle originates underneath the ribs and attaches at the top of the pelvis. It's one of our primary side bending muscles as well. So the point being that muscle, if you release that, that opens up this whole area. Tight? I mean painful there? Tender?
Tight.
Yeah, okay. Tight, yeah. Take a breath. Exhale. There we go. Keep breathing. Excellent. You okay?
Yeah.
Very good. And last but not least is the posterior superior iliac spine. Just above that is an acupuncture point that happens to be in the fascia, the thick sheath of fascia that covers this area, so we want to release that a bit. Keep breathing, excellent. Okay, now I just want to see how your glute medius and minimus are on this side. Tender there at all?
A little bit, yeah.
A more or B more?
Oh.
This one?
Yeah.
Or both of them
I think
perhaps?
both.
Yeah, okay. So this is something that what I'm doing here is dry needling because I'm releasing the trigger points, but it is something that I learned as an acupuncturist. There we go. The difference is when an acupuncturist does that point, they don't lift and thrust to get the release of the motor point. They'll just put the needle in there very lightly. So it's much more effective when you do the dry needling when you release the motor point, because then the muscle's actually lengthening. Okay, let's do the other one. So there we go, excellent. So I'm using the average needles on you. I'm not using the extra large ones, as it turns out. It doesn't look like I'm going to need them. And let me get some more needles and also check the time on the camera. Okay, good, we have 3 minutes. What I'm going to do is, so this is the side with the nerve pain. So I'm going to do the same points on this side, and then I'm going to needle the piriformis as well. I might needle the quadratus femoris, which is below the femoris, because those are both muscles that will entrap the sciatic nerve if they're tight. And then I'm going to check on his hamstring and his calf, because you're having the pain down the back of your leg or the side? The back, right?
The back side, yeah. It's like not direct.
Not all the way, not in the midline, but like here.
Yeah.
So I'm going to release the motor points on the lateral hamstrings here, and I'm going to even check the peroneus and some muscles in the calf where things can get entrapped. So let me see how much time is on the camera now. So we're at 2 minutes and 50 seconds, I think. Let's just do it. Okay. I was debating whether... Let's do a close-up. Let me get the chair. Let me get this needle in first. And I know the camera's not in the best position now. If I only had 3 hands, or a camera woman, or a cameraman. So there we go. You okay? All right. Let's see if we can move. This is the treatment room, by the way, if you're wondering what the space looks like. Okay. Let's see if I put that there. Oh, good. Where are you? Oh, that's you. Excellent. Okay. So let's do these points. That's what we're going to do. I always get a little bit nervous when I'm on camera, and I feel a little bit of pressure to get everything done, so I speed up a little bit, which is probably fine because I tend to do things slowly. So now, let's find that QL point, the quadratus lumborum on this side. Oh man, hard as a rock. Feel that?
Yeah.
So just pressing on that point makes him jump. And it does that, it shouldn't do that, it does that because it's so tight. And he also just traveled a lot, and so, you know, there's also the long extended sitting. Okay, take a breath, exhale, keep breathing. I might do a longer needle on this point if I need to. You okay? That pretty strong? I just want to do, because this is the side we have the pain, I'm going to use a slightly thicker needle, if that doesn't freak you out to tell you that. Take a breath, exhale, there we go. You feel that?
Yeah.
Excellent. Now, what I'm going to do on this side is the ligament that runs over the spine between the spinous processes of the vertebra, and when you release that ligament, so I'm going to start with L3-4. So you needle right into the ligament between the spinous processes of the vertebra, and that really helps. I love how that feels when I get that done. That really helps to release this. There we go. So it's a little tight there, the L3-4. And now let's do L4-5. The space is a bit bigger, and the problem you're having is probably L5-S1. So we're going to do all three.